I'll go.
Great. Hello, those of you who've joined us so far. We're just going to wait a couple of minutes for other people to join us. We shouldn't keep you too long. For those of you who've just joined us, welcome. We're just going to give it a couple more minutes just for the last couple of people to join us for the Why Community Matters report webinar. Shouldn't keep you long. Okay, let's get started. Welcome everybody. We're delighted that over 180 of you registered to join us today. Many of you are making your way into the webinar as we speak. We're delighted to share the Why Community Matters report with you. I'm Sophie Clark from Capacity, and I'm part of a team in Wirral who've been working with the community to develop a new early help offer that's going to support families to thrive. Now, presenting with me today is Natalie Mansfield from Capacity. We've got Elizabeth Hartley, the Assistant Director for Early Help and Prevention at Wirral Council. We've got Councillor Tom Usher, the Cabinet Member for Children, Families and Education. And we've also got Jess from Wirral's Youth Voice Group, who will be speaking up for young people across the borough. In terms of the shape of the session, we'll spend probably about 35 minutes or so talking you through the key findings in the report. We'll be sharing the voices of children and families as we go. Then we'll spend the rest of the session looking ahead. starting to explore what a more effective early help model needs to achieve and how collectively we're all going to bring this to life. Now, there's lots and lots of content to share with you today, but we really do want this report to be the start of a meaningful conversation and to hear your thoughts and reflections about what should happen next. So after the webinar, we will send you an invitation to join us and to continue the conversation on a more interactive platform than this, and that will be over the next 2 Tuesdays. However, if you have got a really burning question today, please do submit it via the chat function and we'll try and answer it towards the end if we can. OK, so before we dive in, I'd like to start by welcoming Councillor Tom Usher, who's got a few words to say, a few words to share about the report. Thanks, Councillor Usher.
Thank you very much, Natalie. So I'll keep my introduction brief because all of the really good stuff is in the content of the presentation. It's been a year and Capacity have been engaging with 450 families to give us a really strong foundation for a new way of working in early help on Wirral. And when I read the opening page of the report, it was so assuring to see that it was the account of a local parent and their experience. The comments were detailed and articulate and honest. And as professionals, the journey to understand what families and communities want and need from an effective early help service in the future should always start with a conversation with those very families and communities. So the report is a testament to all the families who engaged really, and their knowledge of the current challenges that families face when trying to access more traditional style support. When we get support wrong, and many of us will know this from our own experiences, good intentions can materialise into further frustration. What is also apparent is that the right thing for one community is not necessarily the right thing for all communities, and I think that's really demonstrated in the report. I'm confident that the drilling down that has been done to accurately uncover the needs of each of these communities will give us a strong foundation for providing far more bespoke and targeted support at the level appropriate to those who want and need it. One of the quotes that struck me the most from the contents of the report, and you know, it will stay with me, was simply that human beings are creating life-saving networks across the borough, and families want more of this. And I think that phrase, life-saving, it shows that it's not just a desire. Not just an optional condition for allowing families and individuals and communities to thrive and live full and rewarding lives, but it's an absolute necessity. And I think that the current situation that we're all in shows just how important those connections between people are. This interconnective nature of human relationships means that when an individual is not supported in their aspirations, it does not just affect them, but those around them. But likewise, when we get the support right for an individual, there is no limit to their potential, and the effects that this can have can be felt throughout a relationship, a family, a street, and even an entire community. So that to me is why community matters. I thank Capacity and the Early Help Service for the opportunity to speak at this launch and show my support really in doing what I can to ensure that the findings are brought forward, and I hope you enjoy the next hour. I'm very excited myself. Cheers.
Lovely, thank you, Councillor Usher. It's a brilliant opening. Thank you very much for coming along. We're glad to have you too. OK, now, so I thought very briefly, for those of us on the webinar today who might be new to early help, let's start by quickly asking, what is it? Now, the formal definition states that early help means taking action to support a child, young person or family as soon as they encounter a challenge that they're struggling to tackle on their own in order to improve their outcomes and prevent them from being overwhelmed. In Wirral, like many other parts of the UK, early help spans a really wide number of teams, organisations and services who are supporting families tackling really varied challenges and life situations. Early help's available at any stage in a child's life, from pre-birth right through to adulthood, and the experiences on offer locally range massively, from counselling sessions and baby groups, right through to more intensive interventions for families who might be on the edge of social care. Capacity's role is to work with Wirral Council, local organisations and local people to redesign part of early help that's currently called Community Matters, which aims to support families who could benefit from some additional support in order to thrive, families who are sometimes described as being at level 2 or 3 on the continuum of need. Now, it was launched in January 2019 to start to test how Wirral Council could work differently with local partners to deliver a more effective service. Teams knew that a knock on the door from a social worker or a statutory service is not what many parents want or need when family circumstances are starting to become difficult, and that support wasn't quite working. Instead, a group of 6 local organisations were commissioned to deliver community-based support, working with individuals to develop a family plan that could address their unique needs. And at the same time, we were commissioned to redesign and implement a much longer term offer that really meets the needs of children and families here today. Our first step has been to listen, and I mean really listen, for 6 months to over 450 children and adults from diverse backgrounds and communities in Wirral, so that Nat and I could start to understand what challenges and opportunities families face, what the strengths and weaknesses of the current early help model are, and fundamentally, what people living in Wirral really want and need during more difficult times. The report captures these findings, and it's absolutely the cornerstone of the redesign process. All 9 neighbourhoods across Wirral were closely consulted via one-to-one interviews, focus groups, shadow days and questionnaires. Nat, I think you've got the wrong slide up there. And the care and honesty with which local people have shared their deeply personal experiences has been totally overwhelming. We've met children in their school, families in community centres, libraries, health centres, and we've listened to people on their doorsteps, in cafes, at sling libraries and parks, to name but a few. The loudest message wherever we went: give us people, not traditional services. If we could have the next slide up there, Nat. Wirral residents told us, stop thinking and behaving like a service. Stop referring me. Stop putting me on waiting lists. Stop telling me I've got to meet a threshold, only have a set number of weeks, or most importantly, stop telling me what I need to do or doing things for me. Instead, please start creating more safe and inviting spaces and whole family activities where I can build real relationships with people who care about me and who empower me to tackle life's up and downs myself. Now, as Councillor Usher highlighted at the beginning, these relationships are already creating life-saving networks across Wirral. When asked to describe moments or experiences that had had the biggest positive impact on their lives, nearly everyone we talked to described an important person, whether it be a teacher, a GP, a counsellor, a volunteer, a neighbour, or a best friend. Very, very few people described a particular project, programme, or plan. Families don't feel that the current early help model is early enough. They want it to be for everyone, as they know we'll all need it at some point. And they want it to be powered by people and communities, and to use an empowering language and set of behaviours that we all share, so that no one feels ashamed or afraid to ask for help. Adults and children were really explicit about the particular challenges they're facing when they needed support most. And I'd like to now welcome Jess to share some perspectives from children and young people about these particular challenges and what she hopes early help can achieve. Over to you, Jess.
Many young people in Wirral, we know, are struggling with their mental health, and this needs to be a big focus for early help. However, we also feel that there is little support or information when our parents or guardians are unwell, and when we're facing this challenge, we often feel helpless and can start to lose hope. When a parent is overwhelmed, it makes us really worry about their health and what it might mean for the family finances. Many young people don't know who to talk to about these issues, and we aren't always talking to staff at school because it feels embarrassing when your family is struggling. It's really important that early help improves the well-being of the adults around us. Young people in Wirral are really worried about the future and their opportunities, particularly if they do not fit into the standard mould of mainstream school or college. There's a lack of meaningful employment opportunities in Wirral, and we don't feel confident getting those positions even if they are available. For example, a young person with additional needs said, "There's no end game. We get a qualification at a low level and it doesn't go anywhere. People are happy for us to be volunteers, but they don't want to pay us. We deserve to be paid for the work we do like anyone else does." In terms of what's important for the future, we really want to learn things that will help us to succeed and be happy, and we want to be taken seriously. This will help us to build our confidence and feel good so that we believe in ourselves. It's really important too that we get second chances when things don't quite work. Too many times it's one strike and you're out, and this just isn't right. Give us room to make mistakes.
Thanks, Jess. Sorry, we were just having a slight technical issue there, as I'm sure you can understand. I'm Natalie from Capacity, and I've been lucky enough to spend almost a full year listening to the experiences of children and families across Wirral. I've been genuinely and warmly welcomed into homes and communities, and I've been so humbled by everyone's honesty and generosity. What's really struck me over the past 12 months has been people's determination to share their stories in the hope that it'll make family life for someone else even just a little bit easier to manage. Everyone here today has the responsibility to ask themselves, what can I do to make this happen? What's my role? Building on Jess's thoughts, I'm going to start by sharing the main challenges that families have told us they're facing, and we'll hear from some local parents and some local young people who've recorded some excerpts to share. Just to let you know, the examples you'll hear are real life experiences of local families, so if you do recognise anybody, please respect their anonymity. The names and any identifiable information have been changed, with the exception of Lucy, who we'll hear from towards the end of today's session. So the slide that we've got up at the moment, anyone we spoke to, and almost everyone told us about some sort of change that they'd experienced in their life. So from pregnancy and having a new baby, moving school, changing jobs, changes in physical and mental health, relationship breakdowns or bereavement, people across Wirral feel isolated when they're experiencing life's transitions. Adults and young people alike shared their worries about being able to manage, and they want extra help from people they know and trust who can support them to deal with the practical and emotional challenges that they're facing. We'll hear from Olivia now, who is trying to manage school whilst grieving the death of her baby sister and trying to support her mum.
I live in Rockferry with my mum and 3 little sisters and my big brother, who's 16. Mum's also expecting another baby. Last year we lost our baby sister at only 6 days old to a physical health condition that she was born with. It's been a really hard year. After my sister died, my aunties came and took the young kids out for day trips and do stuff together, which I think was really helpful for my mum. Mum rang the school and told my teacher what had happened. I was given a school counsellor, but she wasn't any good. I would have preferred to have the support at home. You may feel comfortable, aren't you? I really just wanted to talk to my mum, not a stranger. Mum had lots of support, and we went to Clare House, which was good because they had a separate bit for the younger kids to go in while me and my mum went in to see my baby sister. At the moment, I'd like to have more one-to-one time with my mum so that we can do normal things together.
We all have experiences that can cause us stress and worry, and change can bring those as well. We know that this can sometimes be overwhelming and lead to our mental health being negatively affected. As Jess said earlier, young people in Wirral are struggling with their mental health. In the hard numbers, around 7,000 children each year in Wirral will have experience of a mental health condition which is serious enough to require a diagnosis. For some context about the scope of the challenge that's faced, CAMHS, the Children and Adolescent Mental Health Service in Wirral, only has the capacity to work with around 2,000 of those children and young people. Even more people, both children and adults, will struggle with their mental health without even reaching the criteria for a formal diagnosis. We know the national numbers are around 1 in 4 of adults, but in Wirral that actually means around 80,000 people. Poor mental health doesn't happen in a vacuum, and it doesn't only happen to a certain type of person, and these figures reflect that. It can affect anyone at any stage of their life, has no one single cause, and it can have a knock-on effect on our work, our relationships, and our ability to cope with the daily challenges that life throws at us. Many of the children and families we listened to spoke of the stigma that is still attached to asking for help, along with the fear of judgment or consequences, and unfortunately in too many instances, and often because of the stretched services, families spoke of the difficulty in accessing support even after they've asked for help, as problems haven't been deemed to be severe enough. Alison is a mum of 2 who spoke to us about her own struggle with mental health and her fears around getting support.
I had postnatal depression after my second baby, and despite having been a school professional and knowing that early help wasn't about removing children, as soon as someone said to me, "I think it would be worth considering TAF for you and the family," I felt the blood drain from my face. I was scared, even though I knew from my professional background that it was supposed to be helpful. I felt like she thought I couldn't cope.
So in our engagement work, approximately 48% of the people that we spoke to over the past year mentioned their mental health or the mental health of someone they love. So Alison's experience is far from the exception to the rule. As we know, having a mental health condition can increase your likelihood of feeling isolated and alone, with conditions such as social anxiety making it much more difficult to make connections with other people. The presence of a mental health condition was the most common contributor to social isolation of those people we spoke to. However, nearly 100 more of the people we spoke to in Wirral told us about other experiences that they'd had which had made them feel isolated, including having a new baby, moving house, experience of domestic abuse, or like Olivia, bereavement of a loved one. So Sarah is one of the local mums who told us that she'd felt like she'd struggled on her own for a very long time. Sarah was really open and honest about some of the real painful challenges that she's experienced throughout her life so far, and about what she thinks would have been helpful along the way. Since the death of both her best friend and her mum in her very early 20s, when most people are just starting to come to terms with adulthood, Sarah's had to overcome life's challenges without those people who would usually turn to for support. Sarah explained how useful it would have been to have someone back then to come around and just help her understand even her housing situation, as she didn't know what support she was entitled to, whether she would even be able to take over her mum's tenancy, and felt out of her depth when she was trying to understand how to run a home. Sarah also spoke of the social isolation that she felt as a single parent, raising a daughter without the help of her own mum.
I didn't have anyone to ask for advice. I just had to try and get on with it. I needed someone who could give me practical advice and emotional support about what it would be like when baby came. When my daughter was born, she was very poorly and had to stay in Alder Hey Hospital for the first few months of her life. I had to give up work and I ended up with rent arrears, but there were whole weeks where I would barely leave the hospital, so I couldn't get it sorted. I needed someone who could help me sort out the bills, or someone to stay with my daughter whilst I went home just to shower and pick up clean clothes. I don't drive, so each trip took hours on the bus, and I couldn't afford taxis back and forth all the time.
So feeling isolated and as though you're struggling on your own was one of the common themes that also came from our conversations with families who were supporting a child or children with additional needs. And that was 31% of the people that we spoke to were facing this challenge. As an example of daily life when supporting children with additional needs, I'd like to share some of Steph and Kenny's story. Steph and Kenny live in West Wirral with their 3 children who are aged 11, 9 and 6. When we first spoke to them, they'd been waiting 35 weeks for a paediatrician appointment due to the behavioural difficulties of their eldest son. He was born premature and from a very early age had showed signs of both high functioning autism and ADHD. Steph shared that school had been very supportive as he's bright and academic. However, maybe because of this, they felt they'd had to push really hard for a referral for additional support, as their son's need for control and constant attention had made family life extremely difficult over the years, especially for his siblings who bear the brunt of his meltdowns. Steph and Kenny's daughter suffers from anxiety and low self-esteem as a result, and their youngest son is also showing signs of being on the spectrum. Steph is a teacher and is used to dealing with challenging behaviour, but she told us, when they're your own, it's exhausting and isolating. There seems to be very little help available. We were turned down by CAMHS, and yet we all need help as a family to effectively manage our emotions. Steph and Kenny's son is due to move to secondary school soon, and they told us they're concerned about how he will cope with the transition, especially without a diagnosis. As an adult, Steph herself has been diagnosed with ADHD, which she told us has been a huge challenge in itself, but has also helped her to understand why her own brain works in a different way to other people's, and that she wants her son and his teachers to have that understanding too. Really importantly, the insights from across Wirral showed us that families rarely identified children's behaviour as the main problem, despite professionals that we spoke to repeatedly telling us that it was one of the most common reasons that families needed help. Instead, families were focused on the underlying factors which contribute to their child's challenging behaviours and their own ability to manage it, be that due to stress, relationship breakdowns, or additional needs. Steph and Kenny's big ask for early help is to empower people with information and knowledge that can enable families to take on the additional challenges they're facing. Finally, I'd like to highlight the impact of trauma. Trauma can take many forms and it's not comparable from one person's experience to another. However, there are some commonalities between experiences, and almost 40% of people who spoke to us mentioned some form of traumatic experience in their lives, including divorce, parental conflict and separation, domestic abuse, substance or alcohol misuse, or one-off events which had impacted them in the long term. Serious case reviews in the past have highlighted that cases involving the toxic trio of domestic abuse, mental health issues and substance misuse cannot be worked effectively by any single agency. We'll hear from Mary in a second, and Mary's a grandma who's been raising 2 of her grandchildren since they were small, and she's sharing her experience over the years.
I am a grandma to 3 girls who are 17, 14 and 9. The eldest and the youngest have lived with me since they were quite little. My daughter Vicky has mental health problems, substance addictions, and she has also been the victim of domestic abuse. She has been unable to look after the children since they were young. People rallied round when I first took the children in. I found out about the children's centre at Seacombe, and the lady who ran it was very, very good. She sent clothes down to us and cribs and things. Now it's very difficult. The girls are older and they have a lot of issues of their own. The eldest has ADHD, depression and PTSD, and she self-harms. The youngest is really struggling and I can't cope. I don't know how to help them to understand their experiences or how they're feeling. I think it's trauma. We need someone who understands mental health, who can talk to me and the girls, as they don't know how to handle their feelings. The youngest has a violent temper. I've been asking for a long time for some help to explain things to her. She used to see a specialist at the children's centre, which was great, but they've stopped that now, and we have to go to St Catherine's. It's really hard because I don't drive, and the children have appointments at all different places on all different days. I can't really take buses because the children can't cope with them. So we have to get taxis everywhere, and it's so expensive. I go to church, my faith helps me, and you can go there and not be judged. That is what gives me the strength to cope with it all. But we need somewhere we can go which is nice and calm and relaxed, where we could talk together with a professional.
Mary's story highlights the long-term impact of trauma on her family, even following interventions from mental health and social care professionals. Her desperate need for support, not only for the children but for herself, is painfully clear. The challenges that we've highlighted so far are not an exhaustive list, but we tried to capture the common themes that have come up on a regular basis when talking to families across Wirral. In the full report, we've looked in more depth at the challenges, assets, gaps in and aspirations for early help on a geographical level, highlighting the differences and similarities between Birkenhead, Wallasey, South and West Wirral. So we also spent some time looking into the 10 lower super output areas across Wirral, which have the same high levels of deprivation, but have contrasting levels of social care. So 5 of the areas have the highest rates of social care usage, and the other 5 have much lower rates comparatively. An LSOA, just for information, is an area of a population around 1,500 to 1,700 people. So we're wanting to sort of have a look and figure out some of the following. Are families facing different types of problems in different LSOAs? Are there particular gaps in support in certain communities? And what role do community assets play in helping families to thrive? So we spoke to individuals in these areas and we looked at the data as well to see what else might be playing a role at the system level. We learned that areas with the highest rates of children in social care also have the highest number of takeaways and licensed premises, such as pubs and betting shops. These areas are also more densely populated with targeted support services, to which you often require a referral. And when talking about assets in the community, families living in areas of the highest social care usage were more likely to mention these referral-based services, whereas families living in the areas with lower rates of children in social care were more likely to highlight parks, libraries and universal support as assets which help them to thrive. There's also more green space in areas with lower social care usage, and families have better social relationship scores and higher belonging scores. The types of challenges faced by families across the borough do not differ significantly. However, families in areas where the rates of social care are higher spoke to us more about more challenges. Keeping in mind that these areas have the same high rates of deprivation, we wanted to dig a little deeper into why that might be. So, as the diagram shows, families' prior experiences of accessing support, either their own or the experience of someone else, play a key role in whether they feel empowered to ask for help at the earliest opportunity. We heard from families that the experience of accessing support in the community was more positive in areas of lower social care usage, despite the same high levels of deprivation. Families living in areas of high social care usage spoke to us of feeling stereotyped by the area they live, that they could regularly feel like they were to blame for allowing their problems to snowball, and ultimately felt like they didn't deserve the help.
Now, it's Sophie again. Hello, everyone. When exploring why families didn't feel able to ask for help or couldn't get it when they needed it in more detail, we had some really critical messages in these communities. Firstly, families described the shame and embarrassment that came with the idea of needing early help, and instances where support seemed to be highlighting their failures rather than building on their strengths. The language and terminology, as well as the process and some of the content, all contributed to these negative feelings. Secondly, despite the best of intentions of many services, residents told us that professionals are often pulled towards need and having to react to crisis rather than preventing problems before they escalate. Many families wanted support but couldn't get it because their issues weren't quite bad enough. And those who had often felt services had to rush to address a service issue rather than treating the underlying problem that could take a lot more time. Individuals also described the physical barriers of groups and services happening, but them being in the wrong place or at the wrong time, making it difficult to attend if they worked, didn't drive, had young children. Families really want early help support that's close to home, preventing the need for costly travel and transport. And they want activities to also take place in the evenings and at the weekend. Families also emphasised how critical it is that services are well promoted and well connected with each other, so that they don't have to keep repeating their story to different organisations or finding support when it's already too late. So, in summary, families want early help to be empowering, to be local, to support and connect with the whole family rather than a specific issue or individual, to be inspiring, to connect them with other people, and to communicate really well.
We've taken the learning from the report back to families and asked them about what that might look like for them. We know it'll definitely mean more community-based activities and an even bigger team of partners coming together to support families to thrive. We've seen during the recent months just how quickly and effectively Wirral MBC, working in partnership with local organisations and communities, can unlock strength, power and resource to get help to the people who need it most. And it's going to be critical that this learning is built into the way forward. Early help will need to offer the following across the whole of Wirral: mental health awareness and support at any age. This means sort of a diverse group of partners coordinating their offers and offering a wider range of supportive experiences that don't require a threshold or referral. Opportunities to build meaningful relationships in welcoming spaces where people aren't taught how to parent, but where they can develop, grow and understand their children more so that they can better meet their needs. And extra support when life suddenly changes, crystal clear information, practical hands-on advice and emotional support from trusted people, whether that's online, by phone or in person. Crucially, an effective early help system needs to be offering these things before families feel overwhelmed, before they can't cope, and before they hit crisis point. Finally, and most importantly, families need to know that support is there and be not afraid to ask for it. So the question still remains, how do we create an environment where more of this can happen? What do each of us in the local authority, local organisations, funders and individuals need to do so that this can happen? So if the key ingredient is great relationships, we'll need to adopt an open and non-judgmental approach where we're focused on strength over risk, experiences are shared, and people feel listened to and empowered across communities rather than assessed and pigeonholed. It'll mean a collective effort built on a shared ambition and shared language used by us all, individuals, the local authority and funders nationally and regionally, including the third sector. Co-design and collaboration will be a consistent feature of the new early help model, and will utilise technology and streamline systems to support people earlier and reduce bureaucracy. Over the next 6 months, we're going to start piloting some new approaches, testing and learning about what works before launching something bigger. So if you're interested in delivering some of these pilots with us, we want to hear from you. We will be holding, as we said at the start, some follow-up sessions on a more interactive platform, and do feel free to use the Q&A at the side, because we'll use some of those questions for the basis for these conversations. Anyone's welcome, parents, families, community members and professionals alike. At this point, I'd like to hand over to Elizabeth to share her perspectives on what will happen next.
Thank you, Sophie and Natalie. It's been brilliant to hear the findings from the Insight work and to hear the voices of local people, and I'm hugely grateful to everyone who's taken part and been so generous in sharing their experiences and their ideas. And thanks as well to everybody who's come along today. This is a bit of an unusual circumstances for us. We would have loved to have done this in person, but we really do appreciate you being here to hear these messages. And we hope that everybody will take time to read the full report when it's shared widely. So when I was thinking about what I wanted to say today, I kept coming back to the notion of the road less travelled. It feels to me as if that's the path that we're on, the less travelled path, which makes this venture both exciting and at times a little bit scary. Now, please bear with me on the path metaphor. I apologise if it's a bit cringy, but it seems to fit with what I wanted to say today. So before we started the Community Matters initiative, we were at the fork in the road. On one side was the well-trodden path of other early help models being used in different local authorities across the country, which we could have adopted in Wirral. And on the other side, a path less clearly marked out. The easiest thing to have done would have been to follow the well-trodden path, but having worked for Wirral Council now for a decade and seen how trying to shoehorn models from other areas into our local authority hadn't been particularly successful, we knew it was time to try something different, time to get on that less travelled path. Now, lucky for us, we've got some amazing navigators and fellow travellers, not only colleagues at capacity, but all the brilliant people in the organisations currently involved in Community Matters. And with them come the people of Wirral, all those hundreds of families who've contributed to this report, and they're the ones who are showing us the way, who are helping us to create a new path. And it's those families, young people, workers on the front line and in the community organisations who know best what is needed and which direction we need to go in. Today we've shared with you some of the key messages and learning from 12 months of conversations, and some of those testimonies have been incredibly powerful. And even though I've read them on paper, to hear those people's voices makes it just that bit more real about what the experience of some of our communities is and how simple some of the things that they're asking for are. Natalie's just given you a brief outline of what we plan to do next in terms of piloting and testing ideas. We do have a number of things lined up, and there'll be people in the audience today that will be part of different ventures that we're talking about, whether that's extending the FMP pilot, working alongside the Cradle to Career, some of the work around helplines and the new online forums that we've been using recently. But over the next 12 months, we'll be doing quite a bit of work. But today, I also want to make a personal commitment to everybody, to those families that took part in this, that what we've learned will go further than developing the new early help model. The insights from this report, we will use them to shape our children's services, our practice, and our partnership approach to working with children, families, and their own communities. So a lot of you will know we've recently established a partnership for children and families in Wirral, which has been led by some really motivated people from across disciplines and across agencies that are going to drive this forward. And we will make sure that these experiences, this learning is shared with those and can have a much wider reach than just the development of this model. I'm grateful to Councillor Usher, our Cabinet Portfolio Holder for Children, Families and Education, for being with us today to support and endorse this work. Both of us, like all of you, have great ambition for the people of Wirral, and we want to play our part in making it happen. Together, all of us can make early help something that becomes normal, everyday activity without fear, shame, confusion, and hopefully even without thresholds or waiting lists. What Councillor Usher and I would like to ask of you is that you come with us on this journey, that you engage with Community Matters over the next year to share your experiences, your ideas, be part of the pilots, and please don't be afraid to ask questions or offer us a new direction. We are listening. Being here today to share this report is a really important milestone on the journey, and we wouldn't have got here without the input from all the parents and the families and all the people working on the front line. We are ready and willing to be guided by you all. And there's one quote in this report which really stood out for me, and it's a parent who said, "Listen closely and trust that I know what I need." And what I would like to say back to that parent is that we are listening closely, that you have our trust, and I hope that we can earn your trust too. And it is now with pleasure that I will pass over to a message from Lucy, one of our contributing parents, who, without cringy path metaphors, has captured exactly what early help should be about. Thank you.
Thanks, Elizabeth. As she said, before we take some time to discuss some of the questions and comments that have come through the question and answer function, we'd like to share the foreword to the main report, which has been written and recorded by Lucy. Lucy's a local parent who's been involved in this process from the beginning. I first met Lucy at a celebration event hosted by Creating Careers in the Arrow Park pub way back in July of last year, which now feels like a lifetime ago when we were all allowed to be in close proximity to one another. But Lucy's commitment to sort of making change happen has been incredible to witness. Also while her and her husband are raising the children and managing all of the trickier things that parenting brings. As well as her involvement in capacities work, she's also contributing to the development of other community programmes across Wirral, and she's just someone I admire very much. She had said that she was going to try and log on to the webinar today. She wasn't going to be able to join us because she's obviously got the children at home, but if you're listening today, Lucy, I just wanted to say a big thank you.
Why community matters? When you face challenges as a family, you can feel like you are missing out on many of the enjoyable experiences that are part of being a parent. I want my children to have amazing memories of growing up, and yet there have been times in my life when I've needed help and support, but didn't know where best to look for fear of being judged. The definition of early help in this report is incredibly helpful because many people don't know that it is primarily about support and not just a potential pathway to social services. As a parent, sometimes you think you're the only person who is going through a particular challenge. So having networks and people who are going through similar experiences is just so valuable. Local communities, face-to-face or online, indeed any kind of supportive relationship, all play a massive role in equipping families with the necessary skills to keep going when life is tough. My 3 children are each so different in terms of their individual strengths and the challenges which they face. But what they all have in common is a network of people around them who are willing to love and support them, whether it be teachers, neighbours or their peers. It really does take a village to raise a child. Communities aren't just the physical environment where you live. They are more about the people around you who make you feel like you belong, who ground you, and with whom you share a common understanding and experience of daily life. The connection I have with my own local community is my greatest source of strength when life is challenging. I am surrounded by love and support from people of all ages and backgrounds. Although we live some distance from our family, our local community is our family in the widest sense, full of joy, shared experience and love. This is why community matters to me. There is so much good work going on already across the Wirral, and my hope is that this report will raise the profile of existing support and ensure that the right help is readily available for individual families. I want to see an early help system which can bring people together before they reach crisis point. It can take so much courage to attend a support group, so even an opportunity to text someone who has been through a similar situation would be a huge help for some families. I want to see a focus on our shared strengths as families and communities, building one another up and supporting one another through challenging times. Together we are stronger.
So thanks again to Lucy there. That does bring us to the end of the Why Community Matters live launch. I'd like to say a huge thank you to everyone who's been part of the report so far, especially those young people and families who've shared their journey with us and helped us to bring this report to life. I've seen lots of the comments and questions coming through sort of relating to the emotive stories coming through from people that we've managed to share on here. So yeah, thank you to everyone that's taken part. We hope you've enjoyed the session and feel as excited about the next steps as we do. We're going to stay on for a few minutes now, and Sophie's going to just lead some of the read out some of the questions and comments that have come through from the attendees. We will be hosting some interactive sessions, probably on a more sort of face-to-face basis over Zoom or Teams, but one where we can talk to each other in real conversation. So we'll send out the information about those events. They'll be happening on the next 2 Tuesdays, but we'll send out the event information with a copy of the full report after this event today. Sophie, if you want to maybe take us through some of the questions.
Lovely, yeah, okay, so we've got some very lovely comments from Steve Spence at Wirral CAMS, from David Robbins at the Safeguarding Children's Partnership, and Narina at Clothing Bank Wirral, all voicing their, thanks and support for going on the journey with us, moving ahead. So thank you, Steve, David and Narina. Emma asks, I think there are services, I think a lot of these services are available for families today, but they're not well known enough. The Early Help Directory is available, but isn't something families would know exist. So yeah, I guess there's a question there for Emma around comms and how we will, collectively get the message out in terms of what's out there.
Sorry, Soph, do you want us to chip in?
Yeah, absolutely.
No, it's okay. I didn't know
back
if there's a direct question. Yeah, I think I know that there's been some work happening on the directory, and it is something that's come up a few times when we've spoken to families. I think it's a useful tool to have, and yeah, I think it's certainly part of the, I suppose the whole redesign is taking into account what are the physical resources that people need and want as well. I don't know if Elizabeth or anyone else has got any comments on that, or if we want to move on to another question, but I definitely see that as part of the design in resources coming up.
Yeah, thanks, Natalie. Just to add to that, we are recognising that digital platforms are going to be really important, not just in terms of people being able to know what's available, know what's out there and how to find it, but also it is a new method of communicating and accessing services. We're very much committed to a new model being self-empowering, that people have control, that people make choices, and that a big part of that's going to be about putting as much online as possible so that people aren't waiting around, that they can immediately start to do things and to reflect on their situations and make choices to support themselves. Before we wrap up, I just wanted to say thank you to people on the comments. There's an awful lot of people already coming forward with ideas about things that they've seen that have worked, about showing their own commitment to supporting this. We will be writing down all your names and coming back to you. So yeah, thanks very much.
Brilliant. There's another. We've got a question from Kerry about whether the in terms of examples where things have really worked, a family shared. Absolutely, Kerry, and you'll find the detail in the full report. And an anonymous question asking whether some of the case studies and sound bites in the report could be used in the development of what individual providers can offer to families. Interesting. Nat, any thoughts on that one?
Yeah, I want it to be a shared resource that anyone can pick up and use to sort of help develop their own services, or share information around what early help is and should be in Wirral. So certainly we can, I don't know about the technicalities of doing so, but happy to have that conversation with whoever would like it. The report will also be available to download from our website after this. Give us a few hours though to just get it uploaded and everything. And we'll also have a copy of this slide going out with the sort of the follow-up email afterwards as well. So yeah.
Brilliant. And we will use like Celine and Lynn and lots of Eve, Alexandra, etc., who've put up really great questions and offers there. We'll make sure that the questions that you've submitted are the starting point for the follow-up session next Tuesday. So thank you all for your time and head and heart as ever. That's great.
Is there anything else, Sophie, that we'd like to talk about, or are we all done there?
Great for me. I'm happy.
Fab, lovely. So sorry, I meant to mention as well, along with all of the stuff that we'll send out, there'll also be sort of a copy of the Ask Questions today. So if it sparks any more thoughts from anyone, comments, questions, feel free to just drop me an email. I'm going to bring all of that together and we will, hopefully continue the conversation over the coming weeks and months. So thank you, everybody.
Thanks all.
Thank you.